Hi everyone, it's been a long time. 2020 has been quite a year so far, hasn't it? Coronavirus has taken center stage in all of our lives, our personal lives, our professional lives. Did you ever think you'd say to yourself, gosh, I just can't wait to get back to work? But here we are. Responsibly opening commerce, getting people back to work again is going to involve several steps, but one of which is expanding the availability of testing. There are a couple of different types of tests that we do for coronavirus. One of which we do for people who think that they have coronavirus right now. We call that a PCR test. That's a nasal swab. If you've ever had influenza testing done, that's that really long, medieval-looking, skinny Q-tip device that they stick all the way in the back of your nose to the back of your throat to collect viral particles that they replicate and test for. The other kind of testing is called an antibody test. When a person gets sick with a virus, the immune system makes different types of immunoglobulins to fight that infection, and we can actually test for those. We make some of those immunoglobulins early in infection, some of them are made later in infection, and they all give us different information about a person's exposure and their likelihood of immunity. And that's the testing I want to spend a little bit of time talking about right now. There are a lot of different companies right now who are actively developing testing for antibodies. So not for people who think that they're acutely ill, but for people who think that they may have been exposed. They may have been one of those asymptomatic carriers or spreaders. The two tests offer different information, and it's important that we have both of them. But here at the clinic, we are going to start offering antibody testing for people who think that they may have had coronavirus in the recent past or even in the remote past. And I think that that will provide really useful information for all of us moving forward. And it's just not something that's readily available right now. I think it will be in a couple of weeks, certainly a month or 2 months, but right now it's been tricky to get your hands on such a test, at least here in our area. The FDA has put its stamp of approval on a couple of different antibody tests which are not yet available, but they have put forth emergency guidelines for other companies who are developing tests such that they can start offering testing so long as their testing protocols meet a certain standard, that their specificity and sensitivity is very, very high, and that they're following standard protocol for tests. And that's what we're going to start offering here at the clinic. Again, this is for people who just want to know. They just want to know. They're not acutely ill, but they want to know if they've been infected before, if they've been exposed, if it looks like they may have some immunity. We are going to start scheduling just lab draws. It's just a regular old blood test for patients without symptoms of active illness that we will mask when they come in the building. They'll be drawn by a phlebotomist who's wearing an N95 and is appropriately gowned. That blood will then be sent off to a lab where we will have a less than 24-hour turnaround time, very exciting, and get those results back. We'll then plan to schedule appointments with patients either via phone, Skype, or Zoom to go over those results. Why don't we just give you results? Because the results aren't a yes or a no. They're a little bit more confusing to interpret than that. There's actually sort of 4 different results that we can get, and we want to make sure that we explain to patients what each of those results mean, and what you can do and what you should do or what you should not do based on those numbers. So super excited to be able to start offering this to the general public. We will be posting information about this on the website and on the Facebook page. I just had my testing done today. Why is this Band-Aid not on my arm? Because I'm a terrible draw, so this is where I got stuck today, which is where I typically get stuck. But your Band-Aids will all be right here on your antecubital fossa, we say. So more to come very, very soon. Very excited to be offering this testing for people who simply want to know if they've been exposed or if they've had the infection in the past. I hope you're all taking care, staying well, staying sane. Thanks so much for listening.